I think since I was a child, I was informed by my mother that I was going to be a physician. And I don't know that I really made plans to proceed in that direction. But when it became time to make a career decision, I found that I was drawn to the medical field. It's a little bit unusual how I became interested in cardiology. After I graduated from medical school, I worked at a large hospital in Indianapolis. And during the first few months, I was pretty much alone taking care of any emergencies that might arise in that hospital at night. And I found that I was very interested in taking care of patients that were critically ill. At that time, I also became a friend with a local cardiologist, and he sort of took me under his wing, and that's when I decided to pursue cardiology. I've been here for about 20 years, and prior to that, I worked as a professor over at USF in cardiology. I've been lucky enough to be involved in cardiology during a period of dynamic change. When I first started practicing cardiology, the treatment for acute myocardial infarction was prolonged bed rest. Currently, we take patients with acute myocardial infarction directly to the cath lab and use percutaneous intervention or cardiac catheterization to open the vessels. This technique has resulted in a phenomenal improvement in how patients do when they experience an acute MI. With the increase in technology and our ability to do more and more, the feeling of gratification for actually saving a life is pretty much overwhelming. I think one of the most important things about being a physician in general and a cardiologist in particular is making sure that we apply this technology in an appropriate fashion. There's more to taking care of a patient than opening up an artery. You have to decide what to do and when to do it, and even as importantly, when not to do it. I think it's easy for me to say that I care very deeply about their welfare and that I always try to do the best to make sure they get the right treatment.